Morning team, it's Dr. George here, and we're at that part of the pandemic where people who have been unwell are starting to look at the door going, when can I get out? So I thought I would do a little video that explains this for you, and I'm going to go probably from the easiest to the little bit more tricky, if that's okay. So when it comes to the exposure to COVID, so if you're a sort of like a casual contact, you've been around somebody who's had COVID, they've notified you, but you've had no symptoms, then basically you just have to watch for symptoms. And if you develop any, get a test. If it's positive, then treat as if you were positive. Now, if you're a close contact, so that's saying, 4 hours of very intimate contact, like you would, as if you were living in a house together, or you're in a tight environment, they've said that you do need to isolate for 7 days. Now, if you don't have any symptoms, and on day 1 you've had a negative rat test or PCR, good luck. And on day 6, if you are still symptom-free and you have a negative rat test, you can leave the house on day 7, but they do recommend that you wear a mask when out and about and to avoid high-risk situations. So that would be like visiting an old person's home or visiting somebody who's immunocompromised or going to a hospital or something similar to that. Now, for people who have had a positive rat test or a positive PCR test, this is where it gets tricky. So if you look at the state guidelines, Victoria, they say that you're free to go on day 7 if you have no symptoms, which is great. However, a great many people who are contacting me still have symptoms. So what the hell do you do? Well, this is where the federal guidelines come in and become a little bit more useful. So if you get to day 7 and you still have symptoms, in particular fever or respiratory symptoms, you need to stay isolated, and most likely for 14 days. Because what they really want is for you to have 3 days where you've not had a fever and your respiratory symptoms have greatly improved. That's the signs that we're looking for. The signs that the infection is on its way out is you don't have a fever and your lungs are starting to feel significantly better. So really, basically, if you've had a COVID infection, what we're looking for you to be able to leave is to either have no symptoms for 3 days or have greatly improved symptoms for 3 days. And that would be no fever or your lungs are on the mend. Of course, talk with your doctor via telehealth, please. Not all GP places are set up to be able to cope with people who have coronavirus, and it's important that they have a heads up if you're heading in your way. Again, like all of the other scenarios, though, if you've had a COVID infection and you're now cleared to leave the house, it's important that you wear a mask for the next week when you're out and about, well, as per state guidelines, and you avoid high-risk situations, places like hospitals, people who are immunocompromised, nursing homes, etc., because you could still have a little bit of viral shedding and we don't want you to accidentally pass anything on. Of course, these guidelines change all the time, so please talk with your GP, state health, and the local guidelines are very, very useful, and I wish you the best. Of course, I'm happy to answer any questions that you may have. Have a great day. Stay safe. Wear a mask when out and about as per your state guidelines. And if you're worried or concerned, it's okay to wear a mask. There's no harm. There's no foul. It's cheap. It's economical. They work and they do help prevent people from passing the virus to other people. And depending on the mask that you're wearing, it can reduce the risk of infection as well. Stay safe, team.